Hi, welcome to MCPH Pharmacy. How can I help you?
Hi, I'm here for my inhaler refill.
What's your name and date of birth?
My name is Sue. My date of birth is January 1st, 1987.
What medication are you picking up?
For my albuterol inhaler.
It looks like you're too early on your refills. Do you want to talk to the pharmacy? Pharmacist, he might be able to help you.
Okay, that'd be great. Thank you.
Alright. This is Tyler. He's the pharmacist.
Hi, I'm Tyler.
Hi, my name is Sue.
Hi, Sue. Do you have a couple minutes to talk about your inhaler?
Sure.
All right. Why don't you have a seat? So my technician said that you were having some trouble breathing. So do you mind if I take a few minutes to talk about how you use your ProAir inhaler?
Okay.
All right. So let me just bring up your file here. What's your date of birth?
January 1st, 1987.
Okay. All right. Here we go. And what medications are you currently taking?
I'm just taking my inhaler right now.
Okay, so no over-the-counter or herbal products?
Nope.
Okay. So everything is up to date in here. So you said, she said that you were too soon on your refill for the ProAir inhaler, and you were having trouble breathing?
Yeah, I'm too early, I guess, but I was just walking outside and I think I'm having my asthma attacks again.
Okay, so what symptoms are you having?
I just have trouble breathing and I wheeze a lot.
Okay. And you're having the trouble right now?
Yeah, right now I was just walking outside and I think I got another attack.
Okay. How often has this been happening?
It's been happening pretty frequently. I would say I use my inhaler at least 4 times a week.
Okay. And how do you use your inhaler?
I take it 2 puffs by mouth every 4 to 6 hours whenever I feel the wheezing or trouble breathing.
Okay. So what I'd like to do today is use a PeakFlow meter to evaluate your current status. Have you ever used one before?
I did at my doctor's office.
Okay. Do you happen to have that with you?
I do.
All right. So have you set up your PeakFlow meter?
Yep, at my doctor's office, and he showed me how to do it.
Okay. So can you show me how you set it up, just to make sure we have all the ranges set up?
Sure. So he had me blow into the PeakFlow meter 3 times, and we took my personal best, or the highest range, and 80% of that value was my green zone, and then 50% of that value was set as my red zone.
All right, that sounds like you set it up properly. So why don't we test your PeakFlow right now, just to see where you're at, so we can evaluate where to go from there, okay?
Okay.
All right, would you mind if I gave you a few pointers on how to use your PeakFlow meter?
Okay, sure.
Okay. All right, so the first thing we want to do is make sure that make sure first that you're sitting up straight. So you want to be able to get all the breath into your lungs, make sure your back is up straight. You can also do this standing. And then you want to make sure this red piece here, which is the indicator, is all the way down at the bottom, because that'll give you the most accurate result. And then you're going to take a deep breath in and fill up your lungs. And then you're going to place the PeakFlow meter in your mouth. So you're going to put your teeth on the edge here and kind of bite down on it, and then seal around the PeakFlow meter with your lips, forming a good seal. And then you're going to blow out the air in a quick burst as fast as you can. And make sure you get all the air out, but don't try to make yourself cough or anything. And then you're going to remove the meter carefully from your mouth. So you don't want to be tossing it around like this, because that could shake where the indicator is and give you a bad reading. Then you're going to record what number this fell on, so you can keep a diary of your scores to see. You can try to figure out triggers or where you are on certain days or when you have to use your inhaler, things like that. And if you ever find that you need to, you want to retest your results, you can do this 2 more times. And then you can record the highest level of your attempts, and that will be where you are. So like you told me before, you have the indicators on here. So the green zone, you're good. That's above 80% of your personal best. If you're in the yellow zone, you should probably be doing your rescue inhaler, which is your Pro Air, to help you. If you get into the red zone, that means you're below your 50% of your personal best, and you should probably be calling your doctor. Okay?
Okay.
So why don't we try this again? And can you show me how you do that?
Sure.
All right, that was much better. So it looks like you landed right in the middle of your yellow zone here. So I guess, combined with your symptoms of the trouble breathing and the wheezing, and then getting into the yellow zone on your peak flow, that means you're probably having some trouble breathing, obviously. So it might be good to use your Pro Air inhaler. Now it sounds like you have been using it, right, when you feel short of breath?
Yes, I've been using it.
Okay, and you've been using it quite frequently?
Yeah, I've been using it, like I said, at least 4 times a week.
All right, so it looks like the Pro Air might be helping a little bit, but you're still having these attacks quite frequently. Since your doctor's in the clinic, would you mind if I went and talked to her? Because it sounds like you might need another inhaler, a long-acting inhaler, to help prevent these attacks in the future.
Okay, sure.
So would you mind if I go talk to your doctor, and then I'll come back and talk to you about that?
That's great.
Okay.
Come in.
Hi, doctor. My name's Tyler. I'm from down at the pharmacy.
Hi, Tyler.
Do you mind if I take a minute to talk about one of our patients?
Sure.
Okay, so I was just down in the clinic with Sue, and she came in trying to get a refill on her inhaler, but she was having some trouble breathing and she was too early on her inhaler. And she said she's been having recurrent asthma attacks, and she's been using her rescue inhaler about 4 times each week to help control her symptoms. And I just had her use her peak flow meter down in the pharmacy, and she recorded in the yellow zone. So she's about probably less than 80, but greater than 50% of her personal best. So I think that because she's experiencing these symptoms over and over, she's having to use her rescue inhaler so often that she's in need of additional drug therapy in addition to her Pro Air inhaler. I would recommend adding a low-dose inhaled corticosteroid, such as Flovent. We do Flovent 110 micrograms per puff. She could do 1 puff by mouth every 12 hours, and maybe do 3 refills to start. And you could always follow up with her in 2 to 4 weeks to see how she's doing. What do you think about this?
That sounds great. Let's go with your recommendation.
Okay, so just to recap, we're going to do the Flovent 110 micrograms per puff, inhale 1 puff by mouth every 12 hours, and start with 1 inhaler and do 3 refills.
That's right.
All right, thank you, doctor.
You too. Have a good day.